I'm going to be showing you how to massage the calf muscle, the calf muscles, and I will talk about individual muscle groups, and we're also going to include the Achilles. Previous videos, I've shown you how to work on the hamstring and the glutes and also the front of the legs. So we're just doing this as one section, but definitely include it as part of a full leg treatment. So the first thing we're going to do is just expose the area that we're working on. Cover the hamstrings up if you can, keep them warm. The bolster is underneath the ankles and the client's prone. And because I'm working on the Achilles, I wouldn't really normally get clients to take their socks off. There's no need. Keep the feet covered, but expose the Achilles here. I'm just going to put the couch up a touch because on the legs we can go a little bit higher. I'm going to be using Naki lotion today, sports massage lotion, which I really rate. I use it with all my clients and also the courses that I run. I think it just goes on great and doesn't leave you feeling too greasy at the end. So apply the lotion, make sure it's nice and warm. With the calves, I find working right at the base of the couch a nice position, so we're not having to twist at all. And we're going to start with what I call a longitudinal effleurage. Try and cover the whole area and work right down through the Achilles. We can move quite quickly onto a reinforced effleurage technique, but be aware that when we work on the calf, it can be quite tender. For some people, it might be the most tender part of their body. So watch the amount of pressure you're putting on and then go with caution and use your feedback as well. So reinforced effleurage. And then I'm going to go to a little bit of kneading just to start picking up the tissue. So kneading is a form of petrissage. So I'm going to come around the corner this way, sit in a horse riding stance. I'm using my thumbs and fingers. Calf fits really nicely into this technique. Sometimes if you're working on the hamstring, you find it a bit harder to pick up, but the calf is normally good hand size. So I'm using thumbs and fingers. I can feel a little bit tightness around the side here. If you're a student studying how to massage and you're looking at anatomy as well, think of the muscles that you are working over. I've got some great videos actually on calf anatomy, bony landmarks of the ankle. So just have a look at those and that will really help your understanding. But let us just have a look on my client here, how long the Achilles tendon is. It's longer than we normally think it is. So if we just get my client to tense up, just come in, zoom here. That's the bottom of the gastrocnemius, the medial head. We've got the lateral head here. So the Achilles goes from there down, right down to the calcaneus. It's a lot longer, just relax. Don't want them cramping up. Great definition on my client who is a sprinter. But you can see now the Achilles is a lot more than just at the back of the ankle. So when we're doing massage techniques, it is focusing really more on the muscular part of the calf, but then working down here is working more on the tendon. Achilles tendon is quite hard to stretch in itself, so massage really get in there just to help soften it up a little bit. Okay, so we've got kneading or ringing, and we've got a technique which we used on the hamstring called crisscross lifting, or it's a crisscross petrissage technique, lifting up the calf off the tibia and fibula underneath, lifting it up off the bone. Because the calf muscle, the gastrocnemius, has two heads, so it's got this medial head and lateral head, you will get tightness, or clients will get tightness in particular parts of it. I generally find people on the outside is tighter, and that's probably just from foot position, but some will get more medial. So as you're working, try and feel with your palpation skills if there's any particular tight areas. So I can feel it just in there, the lateral head. Gastrocnemius goes right from this Achilles on the calcaneus through the long Achilles tendon into the two heads, and it crosses over the knee crease onto the lateral and medial femoral condyles. When I'm teaching, I like to say the gastrocnemius crosses the knee. So if you say it like that, it does remind you that it actually is a biarticulate muscle. It crosses two joints, ankle and knee. And therefore, when you're stretching this muscle, you need to make sure that you've got a straight leg when you do your calf stretch. So it's different to the soleus, which lies underneath. Okay, so from this position, I'm going to do a technique called lengthening. Lengthening, there are a few steps to. Firstly, we need to shorten it, and then the client moves or the therapist moves the leg, and then we apply a deep technique to lengthen as well. So for this, I'm coming around to this side of the couch. I'm going to put my knee up on the couch, which acts as a little bit of a pivot. Just put a bit more lotion on. Okay, so I'm going to do that. Rest the ankle on my knee. And in this position, I'm going to control the ankle. I could get my client to do it, but then you will see them tensing up and it's a bit harder. I'm going to take them into a position called plantar flexion, or toes pointed, starting with my fist there. I'm going to work down the leg, and then I'm going to push the ankle into dorsiflexion. Okay, so dorsiflexion, that would be a nice stretch down through the calf, and at the same speed, by the time you've taken it to that end range, you want to be up at the knee joint line. 4, 5, 6 times. You can work on the lateral head. You can work round to the medial head. Okay, you can also use your forearm if you find that easier. Okay, so we're doing some lengthening there. That helps with limited calf mobility. If you know anything about range of movement, you might have tested the calf range using a knee to wall test, where you get your client stood up and trying to touch the wall with the knee in a calf stretch position. So if you find tension there, that can help to increase their range. So it's starting to feel a lot softer now. We're decreasing the tone. Let's carry on with some effleurage, and we can get a little bit deeper. Using feedback, we need to make sure we are using the right amount of pressure. Use both arms. So I might be asking my client out of 10, 1 to 10, what the pain or pressure scale is. And an 8 is a deep enough, but not too deep pressure. An 8 out of 10. Once you get to 10, they've tensed up and they're not going to take any pressure anyway. Or we can ask if they'd like a bit more pressure. If you ask is it okay, they will just respond with yes. So get into the habit of asking different questions. From here, I'm going to do a little bit of work on the Achilles tendon. So if I lift the leg up slightly, again, you can see the calf relaxing a bit. So from this position, I'm going to use my thumbs. I do tend to say avoid use of thumbs, but they are good for certain parts and certain massage techniques. So I'm going to work with thumb kneading either side of the Achilles tendon. If you've got problems with your thumb joint, you can get in there with an open knuckle or reinforced fingers. So always alternatives. We don't want to put any extra strain on you as a therapist while you're working. So we're doing frictions here around the Achilles. You can do them both together, or you can do them individually. And we can also use the kneading technique I used on the calf. I call it mini kneading. So you're just doing small kneading techniques around that Achilles tendon. Actually feels really good. And the amount of times I've been for leg massage where they don't go anywhere near the Achilles for some reason, but please include that as part of a lower leg treatment. And for me as well, I can do foot massage. That will be on one of my videos. got runners in, if they've got calf issues, Achilles issues, or any kind of plantar fascia issues, all of this technique as a treatment would be really effective. So the last thing I'm going to do on the Achilles is, I call it an S-shaped kneading. Come in closer. So for this one, the Achilles is pretty flexible. So for this, I'm going to push and pull. And you will see a little bend forming. That's it. And then I go the other way. There and there. It will feel a little bit odd to the client because they're really not used to that pressure on this body part. But it's a nice way just to try and increase how supple the Achilles is. And if all you do is work up here on the calf, you're working on the muscular tissue. So include a bit of what I call S-shaped kneading. Knead after. There is an alternative position as well. So if I shake the leg, you can see there's not a lot of movement in the calf on the gastroc. If I bend the leg, there's a lot more wobble. Okay. And from what I said earlier about the gastrocnemius, because it crosses the knee, it's now in a relaxed position. Here, it's in a lengthened position. So as an alternative, we can place it up on the shoulder and we can work down this way. We could be getting a little bit more deeper, focused, and think if we take the slack, put the slack into the gastrocnemius, it could be more Soleus focused, which is the broader muscle that lies underneath the gastroc. I'm going to use a technique called squeezing. I think I made the word squeezing up for this one. I'm not sure it's got a technique. But what I'm doing is I'm placing my fingers there, so I'm not moving the leg around. But my technique is with the heel of my hand, and I'm coming around the corner and pulling it away from the bone there. My fingers are just supporting. So it's nice to put the client in different positions on the couch rather than them just lying straight for the whole session. Okay, come from the top again, place the calf down. Let me just point out where the soleus is. I've mentioned that a few times. So the soleus is a deeper calf muscle. Take off the gastroc. It goes from head of fibula, comes across here. It's wider and it goes through the Achilles back into the calcaneus. Gastrocnemius comes on top of it, superficial, and crosses the knee. So your stretches for the gastroc is a straight knee stretch, straight leg stretch. Any form of stretching for soleus would be with the knee bent. And I'm just soothing off here to finish. How am I going to finish this then? I'm going to do a little bit of a leg traction. So from here, come down the couch, pull, put the sock back up. You can get it. Cover the leg up. And hopefully that would probably combine with a hamstring treatment. So I'm just going to rock down the couch like so. Squeeze the Achilles. Okay, and that's your calf massage.